later. What else? There are probably other things. They'll come up. But yeah, leave any questions down below. Follow Pandia Health on Instagram. We are also on TikTok, Facebook, Twitter. Not super active on there, but we're on there. Also, apologies if there's any background noise. Sometimes I use my AirPods, sometimes not, but I'm going to try without. Sometimes they get a little weird with the microphone. So that is pretty much it. Yeah, let's get started. I'm going to invite Dr. Kelly, and I look forward to this. All right. Let's, Dr. Kelly. She should be on momentarily. Hope everyone's having a great evening. I'm coming from Washington. It's been a beautiful day. Hi, Dr. Kelly. How are you?
How are you?
Good. Thank you so much for joining. You look beautiful. I love your background, and I'm happy to have you on tonight's live. So, absolutely. So I just want to give the people a little intro about you. If you could tell me a little bit about yourself, maybe where you're located, where you're from, what type of medicine you practice, and anything else you'd like to share about yourself, about Simple Healthkit, and then we'll get started.
So I'm Dr. Kerry-Ann Kelly. I'm a board certified obstetrician and gynecologist located in Oakland, California. And I specialize in general women's health, reproductive health equity, and community partnerships. Favorite part of my job is really simplifying very complex medical ideas for my patients in order for them to better understand their health needs, the health care they're getting, and to take charge of their health.
Cool. That's awesome. Honestly, we could use a lot more of that. I feel like sometimes, at least when I go to the doctor, there's a lot of terminology that I'm not aware of. So I think it's really awesome that you're able to better break it down, meet people where they're at. And yeah, so I appreciate that. Any fun facts? Anything else you'd like to share?
Well, I am really a recluse, but I love to travel and I love teaching and education. So this is a perfect platform.
Yay, that's so awesome. Cool. Thank you for sharing that. I know I put you on the spot. We have a couple things to cover, so I want to just get right into it. So we're going to get started with a little bit about reproductive health equity. This may be an unfamiliar term to some of our viewers. I know I wasn't necessarily sure how to define it myself before I spoke to you before. So if you have like a general definition for it, that would be perfect.
So I first want everyone to think about health equality versus health equity. So I want you to think of health equality is giving everyone a pair of shoes, whereas health equity is giving everyone a pair of shoes that fit. So health equity is a state in which everyone can achieve their highest level of health through fair opportunities. So reproductive health equity would be very similar. Individuals are able to achieve the highest level of reproductive health through fair and just practices.
That was great. That was so thorough, but also so simple. Cool. I like the what's the word? I guess the scenario that you gave with the shoe. I never thought of it that way, but that's a really great way to break it down. So in terms of reproductive health equity, previously, I think of the world now as in like pre-COVID, and now I know it's not technically post-COVID, but I guess I don't want to jinx it, kind of over the crazy parts, at least for now. You probably know more about that than me, but how has reproductive health equity changed during this time?
I think in the middle of the pandemic, it really has limited our opportunity for traditional healthcare. So, because of physical or social distancing, we haven't been able to go into the office and see a provider to get medical care or even get necessary surgeries that we need. So, I think the equity of care has really declined in the pandemic, and the increase of disease burden has increased.
Yeah, that makes sense. I kind of a caveat. I'm in graduate school right now. I'm studying occupational therapy, and we were actually just learning in one of our lectures this week about how COVID has impacted so many other health conditions, even just people who were exposed to COVID and didn't necessarily get really sick. Um, Sometimes even have reproductive health repercussions, which is kind of crazy, like heavier periods, things like that. And not necessarily a specific one thing leads to the other, but it's just really interesting how one thing can potentially impact so many other aspects of your health. And yeah, that's crazy. So something that we talked about when I spoke to you previously was a medical desert. I've heard of the term food desert. I don't know if it's similar to that. Um, but if you want to speak a little bit about that and things that society or just in general, maybe the government can do to help reduce this.
Sure. Let's see. A medical or a healthcare desert is like a terminology that we use for populations that have like inadequate healthcare. So hospital closes down or a clinic closes down, you're unable to get a hospital bed or trauma service. Maybe no access to a labor delivery, no dental services, limited pharmacy services. So this can really impact the health of a community. We typically see it in more rural areas, but we definitely see it more now in urban populations. Research states that about 80% of the United States population has a limited or inadequate healthcare structure in some shape or form.
That's crazy. So it's perfect kind of segue into the next thing. We talked a little bit about the increase of telemedicine services. I think that's been one of the positive outcomes of the pandemic is the increased accessibility to telehealth. We'll talk about Simple Healthkit, and Pandia Health is pretty much fully virtual. So do you think that the implementation of or the addition of telemedicine could improve access to care in specifically the medical deserts or just in general?
Absolutely. In general, definitely telehealth or telemedicine increases the access to medical providers. And one good part I can think of being in the pandemic is that we came up with really creative ways to healthcare. So we've leveraged technology to use telecommunications like telephones and video visits and digital health to be able to interface with a medical provider. So instead of going into an office to see someone driving there, waiting for your appointment, the doctors are behind, the medical providers are behind. We can meet people where they are and leverage digital health and telemedicine to increase overall access. Now, this works for a lot or some medical conditions, but certainly not all, but it's been helpful.
Sure. That actually brought up a question for me, again, putting you on the spot. So as an OBGYN, are you able to provide telehealth services? I know certain, like you can't do a pap smear online. I would love that. But are you able to provide some services, consultations, things like that?
Absolutely. I can always have a conversation with a patient over the phone or through a video visit. So I'm able to prescribe birth control. I'm able to review a history, come up with a plan, discuss surgical options if that's what the patient needs. So it's been extremely helpful, especially when individuals can't come in and they have childcare issues or transportation issues. So that has been really great.
Yeah, no, I completely agree. Even in my own experience, it's really nice. And I think like there's definitely something nice about being in person, but at the same time, it's really comforting to know that you have the option to do certain things via video or on the phone, and that your doctors might be even a little bit more accessible that way versus having to book a time and come in and get your child care. There's so many other factors. So yeah, that's awesome.
And I would say that the most common use of telemedicine for me is like follow up for test results and discussion. So that's really been helpful.
Yeah, no, that totally makes sense because it's like, okay, if you're just calling me to tell me my results, why should I need to come in for that? And unless there's a follow up procedure or something like that. So yeah, no, that makes sense. Cool. Okay, so moving on, we're gonna get into a little bit about Simple Healthkit and talking specifically about STDs and STIs. So if you could clarify this, that would be awesome. I realized that I didn't know the difference between STDs and STIs. Kind of embarrassing. But yeah, can you specify what each one means?
You know, the terminology is really interchangeable. We started off with STDs, and then disease is so harsh. You know, most infections are treatable. And so they're really interchangeable. So you will see sexually transmitted diseases or sexually transmitted infections, and we kind of use them interchangeably.
That makes sense. Yeah. Okay, that's fair. So one isn't necessarily wrong if you say it.
No, not at all.
Oh, good to know. Cool. So if you are diagnosed with an STD or STI, what are the potential long-term consequences if you don't get it treated?
So most sexually transmitted infections are treatable, but if they go untreated for a very long time, it can have long-lasting health effects. Like you can have genital pain for women, pelvic pain, difficulty with urination, and possibly inability to have children in the future. So infertility.
Wow. Okay. Yeah. So you want to get it treated. So kind of going into that, what before we even get infected, what is a good way, or what are some techniques to help prevent the spread, and also testing, like how often should someone get tested, are there any specific tests you should consider? If you could go into that, that would be awesome.
Sure, we can talk about all the ways.
Perfect.
Not to spread a sexually transmitted infection is to be abstinent or abstain completely from any sexual encounters. Typically, having mutually monogamous relationships or using barrier protection such as condoms, getting tested early and often normalizing that conversation, and being in physically and psychologically safe environments help us to make better decisions about getting tested. So we mentioned before, like, you know, there's limited access and things like that, but there are always low resource or uh, clinics, community clinics that you could go to get testing. And those should be utilized as much as possible.
Okay. Would that be like a Planned Parenthood?
Like a Planned Parenthood, like a community health center. Yeah.
Sure. Yeah, I know the health center at GW, my university, you can just go and grab condoms, like no questions asked. Usually the
Yeah.
resident advisors have them outside their door. So yeah, definitely. I think people are embarrassed about it, but it's just so much better to be safe than sorry. I mean, as you mentioned, if STIs go untreated, it can lead to so many issues down the road, potentially permanent, like not being able to have children. So it's better, I think, to have a few moments of embarrassment, or not. It shouldn't even be embarrassing, but say you get embarrassed, I think it's still better to have a few moments of that than potentially, life-threatening consequences. So
Absolutely. You are absolutely right. So, normalizing the conversation between you and your partner, between you and your healthcare provider, early and often. These conversations go in every year and ask for a sexually transmitted infection panel. Or, you know, if you think that you've been exposed, inform your partner and you both go get tested.
yeah, no, that makes sense. And that could be like a fun activity you do together. I know couples who have done that. And what a great way to bond and be safe. I also appreciate how you mentioned being in a comfortable, safe setting. If you are going to be sexually active, I think the more comfortable you are with your partner, then the more comfortable you'll both be disclosing the information of whether or not you've been tested recently. And, if they haven't been tested, maybe avoid sexual contact, but at the same time, like, okay, if you are going to do it using a condom, and birth control is great, but it does not prevent the spread of STIs. So keep that in mind. Yeah, it'll prevent pregnancy when used correctly.
Use
But yes, but yeah, no, you will need,
your
yeah, you'll need a condom or another barrier method to prevent the spread of STIs, or as you said, abstinence. Um, okay, cool. So I don't think you said this. If you did, you don't have to say it again, but
Okay.
kind of a two-part. So how often should you get tested? And how, actually, we'll just start with that.
So if you think you've been exposed to an STI, you should go ahead and get tested, talk to your partner about getting tested. But in general, getting tested about once a year is a good practice to have if you're sexually active.
Cool. Okay, that's awesome. That's helpful. I feel like sometimes people say not that much, and then some people say you need to get it every few months, but once a year, that makes sense. And that's easy to remember. You can get it at your gyno visit, like, so cool. And then, so if someone suspects that they have an STD or STI, is the thing to do just really to go get tested?
That is the thing to do. Also to talk to your partner, right? So you can both be responsible and go get tested together, and that really decreases the spread of infections.
Cool. Yeah, no, for sure. And that's the thing too, like you don't necessarily know if you have something. So it's always just better, especially if you have been with multiple partners, to just get tested. And again, better to have those moments of potential nervousness or embarrassment versus like a lifetime of health consequences. Also, Dr. Yen said condoms, condoms, condoms. Very true. Okay. Oh, shout out to One Condoms. We just did a collab with them on TikTok. I think it got taken down because the internet is rude with that stuff. But check out One Condoms. We have a little partnership with them, and they have 60 different sizes, so there's no excuse not to wear one. And yeah, check them out. Okay. Last kind of area we're going to talk about, and Susanna just mentioned it. Perfect. So let's talk about healthcare accessibility, specifically in terms of STI testing. So I want you to talk a little bit about Simple Healthkit, and how it can be utilized to make the testing process easier, more accessible, all of that.
Sure. So Simple Healthkit is a mission-focused company that centers health equity, and they provide, diagnostic testing solutions that are accessible and affordable, and also digital health services to really have a closed loop of care. So they partner with universities and various companies, and so it's really promising that they're able to provide testing and digital health services in a really rapid and a really centered way. So that's really, really cool about Simple Healthkit.
Cool. So how does the testing process, how does that work? Are you able to tell us a little bit about that?
I can tell you a little bit about it. So certainly there are test kits that you can have and collect the tests on your own, and then able to ship it off, and then be able to get your results through a portal. And it's relatively fast, and I think faster than traditional methods. So I think it really leverages the technology and digital health services that has been so useful in the pandemic.
That's awesome. Is it a like a swab or something like that?
Yeah, definitely various samples, swabs, and sometimes urine samples.
Gotcha. Okay, that makes sense. You don't have to like take your own blood. Cool. I just wanted to specify that. Okay. Dr. Yen said, is it a first morning dirty urine? Do you know what that means, Dr. Kelly?
So first morning dirty urine is just first time you urinate after not using the bathroom after
That makes
out of hours. So I believe it is a first catch. Yeah, first catch.
Makes sense. Cool. That sounds really great. I mean, super convenient for sure. It's like a COVID test, and I feel like now everyone's done their at-home COVID test, so we're kind of used to that, doing the swab, sending it off, getting your results in, a couple of days. Yeah, that's awesome. Okay, so let's talk about the stigma around STI testing. I know we briefly touched upon it before, but do you have any tips or anything that you think we can do moving forward to help remove the stigma, around getting tested, but also around, if you do have an STI and knowing that doesn't mean you're dirty or that there's anything wrong with you. They're very common, not to scare anyone, but they are common. So yeah, any tips for that?
So I think the way to remove the stigma is to really just talk about it, normalize having conversations about sexual health, normalize going into your physician and talking about or starting the conversation, because it really can be very uncomfortable to do that. But I think it's sexual health and discussing it is very normal. It's a part of our everyday lives when you get to a certain age to essentially your to end of life. So talking about it more and discussing what it means to be sexually responsible, what it means to prevent sexually transmitted infections and the spread of them, I think can really destigmatize just everything about it.
Yeah, no, I totally agree. And Dr. Yan just like perfectly added to that. She said that there shouldn't be a stigma getting tested because it's actually recommended once a year for anyone under 25.
Yeah, 25 years and under. Absolutely.
Yeah, no, that makes sense. And I mean, we get tested for a lot of other things. You go in for your flu shot every year. You should. Um, and you get your COVID vaccine, and now you're just making sure, you're like, checking another box, like, okay, this part of my health is good, and let's, make sure I'm doing okay otherwise. And if not, we can get treated. And again, not to I don't like how I said that because it's not good or bad whether you have an STI, but something that should be addressed for sure.
Definitely knowledge is power. And the more you know about yourself, your body, your overall health, the better choices and decisions you can make for yourself.
Yeah, no, you said that beautifully. Okay, last thing before we get into just some closing things, and this is just you can answer this however you'd like. What does the future of STI testing look like? What does the future of telehealth look like? And again, we don't know. There's no right or wrong answers to this. So if you have any thoughts, feel free to share.
I think the future of telehealth looks like expansion. It is needed. It is necessary. Traditional ways of accessing healthcare will still continue and need to be improved. We need more medical providers. We need more access to those medical providers. And we need to decrease disparities or the preventable differences that causes diseases in our communities. But I think telemedicine, digital health, it's here to stay. We have advanced so much with our technology that we really need to use that to improve everyone's overall health and achieve health equity.
Yeah. Oh, you tied it all together so well. It all comes back to health equity. It really does. Yeah, no, I think that's awesome. I would love for there to be an increased access to telehealth. I can imagine that it can be a little bit tricky for individuals who like don't have access to a computer or and I know we're slowly making it more accessible, so you can do it on the phone, you can do it not on like a laptop or anything. Um, that actually brings me into a question. I don't know, we might have answered this already, but how do you make sure that your information is still confidential when you're using the internet? Does that make sense?
It does. When you interface with a platform or with a company that is responsible for handling your information, they should have certain safeguards to handle your information. And that's one of the commitments that they give to you in various contracts when you try to, access digital health or telemedicine or anything like that. So they're really in the business of protecting your information, or should be.
That makes sense. And now that I think about it, every time I've done a telehealth visit, it's always through like a private platform situation that they'll send you beforehand. So you're not just in your Google Chrome or whatever. That makes sense. Cool. Okay, that's pretty much it in terms of my questions. Did you have any key takeaways, anything you wanted to promote in terms of yourself, Simple Health Kit, just anything else you'd like to share?
So, takeaway is that healthcare is not one size fits all. Everyone has individual and unique needs, and health equity kind of brings the healthcare that is needed for those individuals in those communities. And it may look different for different populations, and that's okay. So I'm happy to be a part of a mission-focused company that provides digital health solutions and digital technology to provide necessary care for people where they are.
That's awesome. Yeah, I love the idea of just meeting people where they're at physically and also where they're at, emotionally. So many different factors impact our ability to not only receive healthcare, but also then like utilize it effectively. So I think like meeting people where they're at is so important. Have you read A Spirit Catches You and You Fall Down?
I haven't.
Oh, you should. We're reading it for my class right now. It's our book club book, and it just that's like exactly what it's about, and how there's a lot of cultural differences between Eastern and Western medicine, and how is there a common ground, or should we kind of do more of one thing when we're working with certain people? So it's just really interesting. Highly recommend. I'm not a big reader, and I actually like it.
Oh,
So it's a good book. Cool. Okay, awesome. So just some key takeaways from me, as we talked about health equity, very important. You know what? Now that I'm looking at our notes, it totally said reproductive health equality. So I'm glad you mentioned that. I'm so sorry for my reading error. But I appreciate you going with the flow. But yeah, increase of telehealth services, I think super beneficial. And as you mentioned, Simple Healthkit is an excellent option for your STI testing. Make sure to follow on social media. I believe it's just Simple Healthkit is your account, right? I think so. Yeah. And then for Pandia Health, we're just at Pandia Health, and we also provide telehealth services for individuals in, someone correct me if I'm wrong, 18 states. That's probably too low, but telehealth visits for individuals in some states. And if you don't live in one of those states, totally fine. You can still get your birth control prescribed or get your birth control prescribed from your own provider, send it over to Pandia Health Pharmacy. You just fill out a little form online and you get your birth control. 14 states. There we go. Thank you, Dr. Yan. You get it shipped right to your mailbox. It's so convenient. They send you goodies, and it's a great time. Someone asked a question for you, Dr. Kelly. Oh, yes. Okay, so is Simple Healthkit covered by insurance? Oh, are you still there?
I'm here. We had a little delay.
Oh, sorry about that. Can you hear me now?
I can hear you.
Okay, perfect. Two questions. First one is Simple Healthkit at Simple Healthkit on social media.
Yes.
Okay, perfect. And then second question is Simple Healthkit covered by insurance?
Simple Healthkit diagnostic testing is covered by insurance.
Cool. Okay, awesome. Yeah, simple answer. Love it. Cool. Okay, that is it on our end. Thank you so much for answering all of my questions and for being on here. I know you said you were new to like this live situation, but you did great. And I appreciate it. We're super excited to work with Simple Healthkit. I love just the, female-led groups and promoting online services. Yes. And just making healthcare more accessible for, as you said, all individuals, regardless of who you are. Super important. So thank you so much for being on here. Again, don't forget, those who are watching, follow us, Simple Healthkit and Pandia Health on social media to get the latest information from us. And have a great evening. We'll be back next month with some other fun stuff.
Thank you for having me. Bye.
Thank you so much, Dr. Kelly. Bye.